This is a non-confidential briefing for the organization called the National Society of Leadership and Success. The Better World Project is called Don't Sweat It, regarding male mental health in the Tampa Bay area. The student's name is Jonathan Rock, and the project was completed on May 5th, 2022. The concepts of male mental health are an important yet often overlooked health concern. With mental health an issue with both men and women, there are notable differences between both issues that impact them. However, it brings the questioning on why should one address the concepts of mental health differently. Men can develop many triggers that do not regularly impact women. For example, men do experience societal expectations and gender roles. This includes the concepts of not seeking help or not openly speaking about one's emotions to others. This can lead to concepts of warning signs that include, but not limited to, aggression and anger, changes in mood, changes in sleeping habits, difficulty focusing, high consumption of alcohol, feeling sad, hopeless, or emotionally flat, obsessive and compulsive thoughts, thinking or attempting suicide. To complete this project, I decided to work on the concept of male mental health in the Tampa Bay area. This was decided because many do not touch the subject of what the specialty of mental health in the Tampa Bay area is a high-risk area for mental health issues, especially after the COVID-19 pandemic. When looking at these concepts, one must address the risk factors that are associated with this project. These include the following: men who are over the age of 85, men who have experienced trauma, men who have overcome unemployment issues, containing marital breakdowns, have financial concerns, misuse of alcohol and or drugs, history of mental health issues, and any life-changing challenges. Upon the understanding of who was at high risk, it was then become the task of the researcher to finding the partnerships of in what issues must be addressed upon, meaning we have established a core issue and what needs to be addressed, but the concepts come from this core issue. With this understanding, I selected 5 subsets that I wanted to reach upon and address in terms of this project. These include the following: anxiety and depression, mood and exercise, suicide prevention, PTSD, and substance abuse. When struggling through a mental illness, one core component that mitigates the symptoms and the capacity of healthy living. This includes the concepts of using physical exercise as coping mechanisms. If one wants to benefit from these steps, one must get up and move. Adults should move more and sit less throughout the day, with the idea that any physical activity is better than none. To gain the health benefits from exercise, an adult should do at least 2.5 to 5 hours of moderate exercise per week. Hitting the baseline of 5 hours a week not only improves your mental health, but increases your quality of life, giving you long-term health benefits. Those who add muscle building activities at least twice a week improves their overall muscle mass, but also their strength of their bones. One of the most common health conditions that plague both men and women is depression. This is characterized by the consistent low mood that interferes how one functions through a day-to-day function. This is sometimes conjoined with the feelings of anxiety, which is consistent fear or worry for the patient. One can identify warning signs by aggression and anger, difficulty focusing, changes in mood or energy levels, changes in appetite or sleeping behaviors, high alcohol or inappropriate drug use, negative impact on work, school, or family life, having aches or pains with no clear cause, feeling sad, hopeless, numb, or emotionally flat, feeling restless, thinking about or attempting suicide. Post-traumatic stress disorder, or PTSD, is characterized as a mental health condition that generally develops after a sudden traumatic moment or repeated exposure to something upsetting. PTSD symptoms are more common in men, however, treatment methods can be effective in mitigating the impact. Many people experience a traumatic event and heal without a lasting impact. Someone with PTSD does not have the same experience with the trauma, leading to symptoms that are persistent and get worse over time. The complications for PTSD include impacts of normal functionality, problems with work or social relationships, depression, drug and alcohol abuse, and suicide in severe cases. Next, we will discuss the concepts of substance abuse, which is characterized as a brain disease which takes place when an individual suffers from constant cravings. Though these actions start out as a voluntary act, over time these actions lead to what was referred to as tolerance and addiction. The following addictions were addressed for the viewer: alcoholism, cocaine, heroin, ecstasy, methamphetamine, prescription drugs, and tobacco and nicotine. When addressing the viewer, this published work addressed the fears of the consequences of one's addictions and the concepts of one's finances, legals, and one's daily responsibilities. Suicide is the 10th leading cause of death in the United States and the second cause of death between the ages of 10 to 34. In 2019, over 47,000 died by suicide in the United States alone. Men are the more likely, 3 times more likely to take their own lives, with firearms being the main route. Look at the concepts of ACE. If you are fearing that someone you love is having these thoughts. A. Ask your buddy. This implies asking them directly, do you intend to hurt yourself or others? C. Care for your buddy. Remove all means that could be used for self-harm, and then calmly control the situation. E. Escort your buddy. Never leave your buddy alone, and then call a suicide hotline, which is provided later in the presentation. Components of social media have become a major component in terms of sharing and broadcasting information to your followers and friends. Sites like Facebook and Twitter, which were initially utilized in a fun manner, have become a vital tool to establish an online presence. The rationale for utilizing these tools were as follows. The tools and information engage with those who directly need the material that is being addressed. Organizations can share such materials so that those who need the information can use it promptly. Using such tools is free and has no cost in using them. This is a concept that can quickly broadcast information and with no cost to the Better World Project as a whole. Social media makes sharing information easy, where your information can be seen in the construct that you hope within thousands of people through likes and shares. Throughout the Better World Project, I've utilized the following leadership skills to accomplish the underlying goals. Empathy, containing the capacity to be open-minded and to understand the capacity of one's motivations and being able to connect them in a deeper level. Accountability, which implies giving credit to who deserves it and taking responsibility for taking blame whenever it is necessary.
Effective communication implies using language as a tool while using active listening skills while addressing others who benefit from the project. Humility focuses on the concept of problem solving instead of self-promotion. This implies looking and considering the greater good of the community rather than oneself. Resilience in containing true grit in accomplishing the task at hand and completing all the tasks. A SWOT analysis gives one the concepts of the current strengths, weaknesses, opportunities, and threats of the given project. I have specifically chosen to contain two aspects that are arranged in two separate colors. This is blue, which identifies the underlying issues in male mental health. Then there is red, which looks at the Better World Project specifically. The following are what is identified. Strengths. The coordination between healthcare providers in terms of the ERT system, efforts to reduce stigma in terms of the mental health overall. Many organizations and workplace settings are taking a stance on mental health and emotional stress and finding tools for their employees, and the desire for the concept to be addressed within the community. Weaknesses. Barriers towards the lack of mental health facilities that one can go to in the Tampa Bay area. Difficulty in terms of giving individuals who need mental health the motivation to undertake those obstacles. Difficulty to understand where to push material so that others can see. Opportunities. Looking and reconstructing how mental health is provided so that more individuals can seek help. More outlets and support with decreasing stigma towards the concepts of mental health. Looking at ways of creativity, specifically through social media, to showcase material, and then utilizing organizations to demonstrate the need of these concepts. The underlying threats that were presented were patients contained the concepts of burnout, where the desire to act in terms of their mental health overshadows the desire to get help. Overall lack of mental health education. Mental health stigma with that the population created and the thought process that one is lazy or unmotivated to address one's mental health issues, and the motivation for others to utilize the concepts in their daily lives. My future advice for any individual who chooses to participate and engage in the Better World Project, one must understand and utilize time management. This requires taking the time to understand that the Better World Project is a process which will take longer than one anticipates. The following are tools that one can use to help manage the baselines of what is required. Containing an understanding of how to spend your time with containing a time log and how you can set your time priorities. Setting priorities and ranking which is the most urgent. Using a planning tools in the terms of planners, calendars, phone apps, wall charts, index cards, and notepads. Getting organized and taking care of random clutter, which leads to strong negative impacts. Scheduling appropriately and ensuring that there is time for yourself to relax and recharge. Delegate in terms of getting help from others so you can prioritize your time. Stop procrastinating on what is essential for your overall day. Eliminate time wasters and realizing that it takes time for a large portion of your time. And avoid multitasking and losing time from switching roles. And of course, always staying healthy for oneself. Anytime that mental health is addressed, it's important to take the time to indicate contact numbers of organizations so you can help someone that you know when facing these complications. The organizations that you may address or contact or call include the National Alliance of Mental Health, the National Suicide Prevention Lifeline, Face Its Foundation, Heads Up Guys, Movember Foundation. Take the time to remember the following abbreviation of ACE, Act, Care, and Escort. This can help you save a life. Thank you for taking the time you spent in enjoying the work that was completed for the Tampa Bay area. Please feel free to take any work to spread within your own community for the concepts of male mental health.